So, Susanna, could you briefly explain to us what the ESCAPE project is?
Sure. So with ESCAPE, we want to improve the care for patients with multimobility, but also their carers, as we know that both are challenged because of the impact of multiple diseases, and also because we don't everywhere in the world have integrated care. So we decided from the very beginning also to introduce the carers, as they are important in this whole process. And the purpose of ESCAPE is to develop and evaluate the clinical effectiveness, cost effectiveness, and cost utility of the integrated holistic biopsychosocial patient-centered intervention that is specifically targeted to the needs of elderly patients with multimobility, while also involving their carers. So that's kind of the first objective. And the second objective is to introduce and test quality indicators to assess the quality of healthcare for patients with multi-mobility. And the third objective is to contribute to guidelines, obviously, depending on what comes out in terms of the results of the project.
So maybe a question, for anyone here is, for a patient and their carers, what's a normal situation for them when they enter, let's say, a sort of generic European healthcare setting? How are they dealing with their, multiple illnesses? How is their care supporting them? And then how is ESCAPE trying to reevaluate that?
So, okay, I would say the normal thing is in most countries, patients have general practitioners, family physicians who provide long-term care and who try to oversee also the different specialist treatments that are required. But it's in most systems rather difficult for the patients and the carers to find the adequate specialist, to get treated in time. So there are sometimes long waiting lists. Sometimes also there are community resources available that would help the patients a lot, but the person at the center, the general practitioner might not know about them, and it's not in their tasks to make connections and to give recommendations for patients to enter, for example, these community services. So the new thing in ESCAPE is that there's a person, the care manager, who builds up a contact with the patient, who explores with patients and carers what the preferences and goals are, and then sets out to make the necessary connections to the different resources.